And welcome back. I'm Greg Seltz. Yeah, I love that. Practical solutions to life's problems. Well, we're going to talk about an issue here that needs some common sense, needs some clarity, leads the light to be shined into some of the dark corners of these issues, too. And so I don't fully have a grasp of it, but our next guest, I think, does. Ambassador Andrew Bremberg, he has served as the assistant to the president and director of the Domestic Policy Council for President Donald Trump, and he's here to talk to us about healthcare transparency rules. They already exist, but they need more enforcement. So we're going to talk about some issues in healthcare, and I think it's going to be a real eye-opener for you. Welcome to the program, Ambassador Bremberg.
Hi, thanks for having me.
Well, listen, let's just start off with this. What convinced you that the biggest problem in healthcare isn't simply cost, but the secrecy surrounding how a lot of these costs are determined?
Yeah, the lack of price transparency and the secrecy is what's really driving the cost to continue to go up. You know, as a conservative, I believe in free markets. We want to have free markets across our entire economy. And the fundamental problem is that in the healthcare sector, which is huge, it's almost 1/5 of our entire economy, we don't have any form of functioning markets where people compete on price. You know, every walk of life, everything we purchase, every goods or service that we pay for, we can see the price. We can see the price up front. But that just does not happen in healthcare right now. And that's the fundamental problem that's leading uncontrolled healthcare costs just to skyrocket and go up. And that, whether it's the providers in the hospital side or the insurance companies, they are all making more and more money every year by hiding their prices and spending other people's money.
Yeah, I want to get to that too, because I've got a take on this, but I want to hear you completely out on this before I give you my take on it. Did you have someone in particular, a family patient or experience in mind that illustrated the frustration that you were, getting to the heart of with these unexpected medical bills, et cetera, et cetera?
I've had it for family members. I've seen countless Americans that have suffered from high, typically hospital bills where they schedule a service. They go in for a service. Sometimes they're not given a price in advance. Sometimes they ask for a price and are told either they can't get one or they get a kind of hazy estimate and then get slammed with huge bills that come after the fact that were never disclosed up front, regardless of whether or not their insurance are going to cover it. And they, as many of us know, when you walk into a hospital now, you typically have to kind of sign with a digital pen on one of those little pads where you don't even get to read or see what you're signing. And what you're signing is you're signing your financial life away.
Right. Well, it's kind of like, listen, it's kind of like, well, we'll know what's in the bill after we sign it, right?
That's right. That's right.
And that's just not a good way. That's not a good way to practice major purchases, especially when it comes to your health care. Well, patients can't fight fraud if they can't see it. So let's get down to the ordinary American then. I mean, how do we start to address this as ordinary citizens? Because it seems like the health insurers, they tell us, no, this is our decision, not your decision. The politicians say the same thing. And we go to the doctor and he seems to be hamstrung by some of this stuff too. Talk about the logistics of all of that.
Yeah, no, I mean, you nailed it. It is a real problem. It's frankly a real crisis. That's really underlying the massive affordability crisis that millions of Americans are facing today with the massive increases in healthcare. And if you look at any chart that costs the inflation or rate of growth of the cost of any good or service in the United States right now, hospital costs in particular and healthcare overall leads that charge. Everything else is much, much lower, and it's because of the lack of prices. Now, the key though is that what we need is the government to do its job and to enforce the laws and rules that are already on the books. I'll just give two examples. One, President Trump in his first term, mandated that we have real price transparency that had just started right at the end of his first term. And we had, 4 years of a Biden administration that basically refused to enforce those rules, specifically that required hospitals to post, online files with all their price information and required health insurance companies to post files with all their price information. So last week was a big week in that the Trump administration actually announced they had sent over 500 warning and enforcement letters to hospitals around the country that were not in compliance. All last year, and President Trump's first year back into office, They had worked to explain the regulations, to tighten those rules that required hospitals to post their prices. And just this year, those went into effect. So it was a big deal last week when Secretary Kennedy and CMS Administrator Oz announced these 500 enforcement actions they've begun, and that hospitals kind of have one last chance to start posting their prices, or that they'll be subject to fines of up to $2 million. So that's an important big step.
Right. And, you talk about how the advanced explanation of benefits was authorized years ago, but never fully implemented. I guess where I struggle with a lot of this, the same people who then kept the prices concealed so they could keep going up are now running on platforms saying that they want to reduce prices for you, that they're the people who want to make your life better, and they're going to do it with more policies, and they're going to do it with more of this and that. And you're telling me something very basic, which is Trump just wanted transparency. He wanted you to see what you were spending your money on so you could start to compare and contrast and hold people accountable. They thwarted that. Why can't we just say they're the thwarting of this, and these are the people that want you to have transparency and have a dialogue about which one really will work? But that's not the dialogue that's out there.
No, and right now that's you mentioned the advanced explanation of benefits. That really is the next key step that the Trump administration needs to do. As you mentioned, he signed a law at the end of his first term requiring that, not only getting that notice, a month, 2 months after we get care from your insurance company saying what your explanation of benefits is, we're now supposed to be getting that before we get our care. And that has never been implemented. The Biden administration completely ignored it and dropped the ball. And we really need the Trump administration now to implement that so that every American can see a price before they get care. It's the law. It's our right as citizens right now, and it's not happening.
Right.
So that's something I urge everyone to contact the Trump administration, your elected members, to say, we deserve this. It's already the law. Congress is, in fact, Congress frequently doesn't do its job. In this case, it actually did, and it just needs to be enforced. So I think that's something that we need to demand, because that's probably the most concrete thing we can do to protect patients from gross overcharges and from, really exploitive behaviors by a lot of the hospitals these days.
All right, I'm going to either show my ignorance, demonstrate my ignorance, or I've thought about this for a long time, because I was self-insured for about 5 years. So we have, it's a long story, but we have a corporate health plan, and for some reason, because someone else, I was working with another guy, and if I accepted the job with him, I had to go off insurance. So I paid for catastrophic insurance. I got a stipend of back then about $5,000. And if I spent that money, I had to spend it in cash. So if I went to, if I was sick, I went to the doctor, but I had to pay for those things in cash. I didn't have the insurance for that. I had catastrophic care, and I had enough money to go if I needed to go. Well, what was interesting is there was always an incentive. If I went to the emergency room, that was way too expensive, so I waited for the doctor unless I was really sick. And if I didn't get sick that year, I got a bonus. There was an incentive to go to the hospital only when I was really sick. And if I went to it, then I had catastrophic care, so I didn't get whacked. I just felt like that made so much sense. And so many doctors today say the insurance industry boggles their mind too, because some of them say, we want to practice medicine with you, but by the time the insurance gets involved, there's a third party telling even me what to do. And did I give a simplistic understanding of a market strategy? Because it worked relatively well for me for those 5 years.
That's certainly right, and unfortunately, that's a symptom we see across the entire healthcare sector right now. Now, I'm hopefully during those 5 years, it sounds like maybe you avoided any serious catastrophic healthcare costs and illnesses, because that would have helped you out a lot right then. But so many Americans today are forced to have much higher deductible plans that expose them to a lot more, as you say, first dollar coverage costs in terms of they're on the hook for the first, sometimes for a family plan, easily $10,000 of out-of-pocket costs. So you've got a lot of families with that, which is all the more reason why they need to have access to prices to know how much will care cost at this hospital versus another. I mean, studies are showing that sometimes in the same hospital, the very same hospital will charge 10 times difference for the exact same care, depending on who the payer or the insurance company is. And within a city or region, you can easily find price differentials of way up over 30 times price differences. So these are real efficiencies. I mean, I drive half a block to go to the other side of the street to fill my car with gas, at the cheaper gas
Right.
station. I sure as heck
Right.
am going to shop around and get a cheaper MRI or CAT scan if I can save thousands of dollars.
Well, and my argument was, they said you got to have catastrophic. So if I did get really sick, I had catastrophic insurance and I could actually have all those things done. But if I was just paying for the average stuff, which, going to the doctor may be $150, going to the emergency room would be $1,000. But when your plan says it's both $50, you go to the emergency
Right.
room. Yeah, but then that costs the insurance company that X number of dollars, which drives everything else up. And then there was incentives for me not to spend it at all if I could take care of myself, because then I got a raise at the end, because that money then was translated into a bonus. And I thought, man, this makes total sense to me. And what you just talked about, that was the spirit of, I want to get 10 cents cheaper gas. and I want to be able to do it for my healthcare services. My doctors, though, told me that they're frustrated by this too, because they want to provide services that you and I can see too. Are they victims of this system as well, or?
Absolutely. I think, the larger institutional actors, like the large health insurance companies, the largest healthcare systems, these are the ones, the large pharmacy benefit managers that are owned by most of the health insurance companies are the ones that fight the hardest to keep their prices hidden. I always, sunlight is the best disinfectant. And I always say, whoever's arguing against transparency is normally wrong. And and look, healthcare, and also healthcare really is complicated how the rules work and financing on the back end works. And all the different actors have an excuse or a reason for why they do something. All that's usually true. But the key solution to that is, okay, we're gonna make all the prices transparent and we're gonna follow the money. Right. So when you have this health insurance company complaining that these hospitals are billing too much, well, let's see it in the data.
Let's see it.
The hospital saying these insurers aren't being fair in their reimbursements. Let's see it in the data. Like, that's what we want. We want transparent, pricing for how we purchase healthcare to protect Americans and lower costs.
Maybe we should apply that to the Voter Act too. The same thing. We just want to see how it's actually happening. That's right. All right. Actually, think about this. We'll come back and we'll start with this question. If every American could take away one lesson from your article before their next healthcare encounter, what would you want it to be? So think about that over the break, and we'll start with that right after this. We're talking with Ambassador Andrew Bremberg, and boy, we're getting a refreshing take on what can we do about this healthcare stuff. Back in just a minute. And welcome back. We are talking with Ambassador Andrew Bremberg. And Ambassador Bremberg, I don't know, your name, Andrew is the come and see apostle. You're the one that says, come and see, I got the data. Yeah. I think you're living up to that name, my friend. I think you are.
Oh, thank you.
Welcome.
Thank you.
Welcome back. Welcome back. So talk about this, so people are listening and they're saying, all right, here's a guy who knows a lot about stuff. I'm an average Joe or Josephine. I got a healthcare encounter coming up. What does this mean for them? How should they be thinking about a lot of these things?
Yeah, let me take it as one at a global policy level, and then at a very practical level for patients seeking healthcare today. So at the policy level, in addition to the good actions the Trump administration is taking and hopefully will take on getting patients their advanced EOBs, Congress is actually working on a bipartisan bill that would radically transform price transparency. There is strong support in both parties, amazingly, right now, for price transparency. It's called the Patients Deserve Price Tags Act. This is something that the Senate is working on right now. And we actually have great hope that this will see some movement coming soon. It's clearly something the president supports as part of his maximum price transparency initiative as part of his healthcare plan. And we're very bullish on that. So one, I definitely encourage everyone to contact their elected officials and demand that we see prices by passing the Patients Deserve Price Tags Act. But then coming down to the personal level, we've worked and helped patients all around the country who've been saddled with terrible healthcare bills. So if you're going to get serious healthcare work done, two important lessons that I would say. One, ask for the price up front. Ask for a price. 9 times out of 10, they're not going to give you an actual price, but you should demand at least some sort of written estimate. It's really important that you get that in writing. and you understand like what they have included in that estimate and what they're not including. Now, again, this should be a real price once the advanced EOBs go into effect, which they should have gone into 4 years ago. But still, the best step you can do to protect yourself is to ask for a price up front. And then two, and this will sound ridiculous, is never pay the first bill. There's a health reporter that wrote a great book called Never Pay the First Bill, where unfortunately has become kind of standard practice in the healthcare space to just overbill patients for services that weren't provided, or for what's called upcoding, charging for higher rates based on supposedly like higher complication factors or other elements. And, you know, unless you have an actual price up front that they bill you that price, you know, the advice is never pay the first bill, follow up and ask, why did this charge go up? Particularly if you've got an estimate in advance, that gives you some level of protection to know, hey, I was quoted this, what happened, what changed, why is the price so much higher? So I think that's something critical that every American can try to do to protect them and their family and try to take control of their healthcare spending.
Well, you just kind of scared me because, you know, I've not had a whole lot of major issues. When I was a kid, I went to the hospital a couple of times, but it was never a big thing. And now when you were talking about 10 times more for the same thing at the hospital, this is really there's a lot of people that are burdened by this, that are enslaved by this right now, aren't they?
Oh, absolutely. Medical debt has grown to historic proportions. It's the number one cause of bankruptcies in America. It is the crushing issue around affordability right now. And if you think about young families that want to have children, you know, just the cost of labor and delivery for bringing a new life into the world. I mean, one, you normally have roughly a 9-month lead on that, and it shouldn't be that hard to get a price estimate. But it's nearly impossible sometimes to get a meaningful estimate from the hospital where you're planning your labor and delivery, to get an understanding of what that is going to cost, because it can truly mean the difference between tens of thousands of dollars and being able to shop around and realize if I go to a hospital, you know, 5 miles away, I can save tens of thousands of dollars potentially on a labor and delivery charge. That is hugely impactful. And unfortunately, we've seen cases where people get charged literally over $100,000 for labor and delivery, which is, you know, should almost never be the case.
Wow. Okay. Well, obviously there's going to be resistance to this because somebody's making a lot of money. So what do you anticipate from the hospitals, the insurers, the pharmacy benefit managers, what do you think?
Unfortunately, all of them are currently benefit from different parts of the, you know, hidden prices in our system, and that they benefit from this because largely they are all spending, you know, other people's money. No one's a good steward of other people's money, and that's what's happening. The vast majority of Americans actually get their health insurance coverage through a job or through their employer, and most of the time in those cases, it's actually the employer, it's actually that company or union is actually paying for the actual healthcare bills. And the insurers and hospitals have figured out, you know, historically, you think the insurers on one side of the deal and the hospital on the other side, and they're kind of a inherently adversarial relationship. But unfortunately, in so many cases, they're not. In so many cases, they're both on the same side of how can we extract more money from this person's employer or this patient and their own dollars that they then kind of argue about how to split.
Right.
And all the while, that just drives total healthcare costs through the roof, as we've seen over the last decade plus.
Well, and I try to, with a lot of these issues, I try to say it in such a way like, how would I understand what you're talking about to me? And I keep thinking it like buying a car. I've said this 3 times today already because I've been lecturing to some folks about good government, limited government, et cetera. And I said to them, if you give $30,000 to a person and say, go buy me a car, there's no way they're going to come back with a better car than you would have gotten, because they're not going to spend all day shopping for your car, and you might walk out 3 times. I'm one of those guys that says I'm walking,
Sure.
I'm not putting up with that price. And by the time you're done, you get the best price. But they'll come back, they say, well, I spent an hour there and I got you a decent car for $30,000. And you're like, yeah, but I could have gotten the $40,000 car for $30,000, not the $26,000 car for $30,000, right?
So this is why I love your example and analogy, because on the one hand, you're completely right. But on the other side, the reality in healthcare is actually so much worse than that example.
Oh, no.
What's happening is you're not given, here's $30,000 to go buy a car. You're told, there is no budget. Go buy a car. You go to the dealer and you say, how much is the car? They say, no, just sign here and drive the car off the lot.
Right.
We'll bill you later.
And we'll bill him.
We'll bill you later. They bill you later. You have no idea what you're going to get hit with. And then it's a combination of between the patient and usually the vast majority of the time, your employer that get hit with a massive bill. And this is something people, that's more complicated. People don't understand because so many workers get their insurance through their employer. We've seen workers' wages remain stagnant over the last several years. But a big reason of that is that what would have gone to workers' wages and pay increases instead has gone into these huge hikes in healthcare costs. So employers, instead of giving you a raise, are having to spend more to provide the health insurance benefit. It again keeps having higher and higher deductibles, but it's because both the hospitals and the health insurance companies that are supposed to be working for the employers are just taking more and more money out of their pockets.
Transparency is the way forward. We've got some decent bills, and we've got some already bills on the books. We just need them enforced. And Ambassador Andrew Bremberg is keeping us on top of that. Where can they go to read more about this? Because I know there's much more that folks can dive into.
Yeah, I encourage everyone to check out patientrightsadvocate.org. Patient Rights Advocate is an incredible nonprofit that advocates for price transparency and helps provide information to patients about how to address healthcare bills.
Hey, please come back and talk to us more about this because I learned a lot today. Thanks for being here.
Great. Thank you.
Okay. God bless.